About constipation. Now, constipation, most people think that constipation is just having a hard stool. Yeah, but it is more than that. Hard stool is one of the signs of constipation. However, not having a bowel movement in 72 hours is considered as constipation. Whether it is loose stool, whether it is normal stool, whether it is diarrhea, whether it is a hard stool, that is constipation. Yeah. So simply, less than 3 bowel movements in a week is constipation, regardless of the nature of your stool. Now, so when you have constipation, you try different methods or different ways so as to relieve yourself. And you must have been told to take a lot of water if you're having constipation, true? And sometimes you're even told to take a lot of fiber in your food. And sometimes you'll actually be given those purgatives or the laxative to help in easing your stool. Now, the reality is none of that is coming to help you. I know you must have realized you're taking a lot of water, say like 3 or 4 liters of water in a day, but the constipation is not going anywhere. Why? Because your gastrointestinal system is not like a pipe. Like you have to take water through the mouth and then it goes all the way to the rectum to ease your constipation. No. When you take this water, some of it will be absorbed into the skin. Some of it will go to the urinary system. Some of it will go to make the tears, the mucus, the tear glands, to make sweat and all that. So just a small percentage of it goes through the digestive system. Yeah. So taking a lot of water so as to ease stool doesn't even make sense, because not all of that water will go to the gastrointestinal system. So taking a lot of water will not help. I'm coming with the solutions. Now, the other mistake is taking a lot of fiber. Understand that human beings are not designed to digest fiber. No. The fiber comes as food for gut microorganisms. It comes as prebiotics. Okay? So the gut microorganisms, or the microorganisms that aids in the digestion process, they eat or they consume that fiber, and then in turn aid in the process of digestion. So the more you take fiber, the more you overfeed these gut microorganisms, and therefore this makes them lazy and unable to digest food, so more constipation. Yeah, I'm talking about those people who eat salads every day. You're eating salads and then you end up with constipation. Yeah, you're eating all these vegetables. Talk about the diabetic patients. They are told that their food is supposed to have a lot of fiber because fiber is not digested fast. I don't know. Hey, you've been taking all that fiber, but this same patient is constipated. So the moment, they take that type of a diet, and 3 months down the line, they are back to the hospital with constipation, and then they'll be put on drugs for constipation. And some of these supplements that are advocated for in diabetic patients are actually calcium supplements. And one side effect of calcium supplements is that they predispose you to more constipation. So the drugs like the Ducolax, the Lactulose, they will be there trying to ease the constipation. But that is managing the symptoms when you understand that your body is not designed to digest the fiber. You limit the amount of fiber salads that you're taking, even the vegetables you're taking. Yeah, even some of these fruits that you're taking that are not necessary. They are not necessary. They're actually going to cause you more harm than good. The modern fruits, they are coming with a lot of fiber, so more harm for you. Yeah. And then the other mistake is taking those laxatives, the drugs that aid in constipation. They help you to relieve yourself. Now understand that your colon and your rectum are some of the organs that you can train habits. For example, if you're used to going to the washroom around pooping, to be precise, around 4 a.m. every morning, it doesn't matter where you'll be at any time at 4 a.m. You'll just wake up and go to the washroom, because that is how you've trained your gut to behave. Okay, that is a routine, that is a trend you've trained that gut to do. Now, When you rely on these purgatives or laxatives and you use them for a long time, the gut does not know how to relieve yourself if you don't take the drug, and therefore each time your gastrointestinal system, your rectum and your colon will always be waiting for you to take that lactulose, to take that Ducolax, to take that drug, so that you can be able to relieve yourself. So if you don't take it, there's no pooping, so more harm for you. For how long are you going to use that drug? Yeah. So those are the mistakes that you do. You take a lot of water, it doesn't make sense. You take a lot of fiber, it doesn't make sense. You take a lot of laxatives, and then more harm for you, because every time your gut will be dependent on that drug. So what do? What is a smart way? As you're taking that water, make sure you add some salt in it. Salt. By salt, it means you actually rehydrate yourself. And by rehydrating, I mean you've reduced the amount of water and salt that is being excreted by the body. Okay? So more reabsorption. And every cell has access to water. And when you do this, you are able to attract as much water as possible to your gastrointestinal system. This helps or aids. It aids in loosening the stool, and therefore makes it easy to relieve yourself or to poop. Number 2, too much fiber. Reduce the amount of fiber you are taking to 3 or 4 servings in a week only. You don't need all that fiber anyway. Yeah, you take all these vegetables, but thinking that you're getting the vitamins from it, but you're cooking in seed oil, so they cannot even, the fat soluble vitamins cannot be absorbed adequately. So the only thing that remains is the fiber. So you take the fiber from cabbage juice, you take fiber from fermented cabbage, you take fiber from salads, you take fiber from cooked vegetables, you take fiber from sweet potatoes. You know, at the end of the day, constipation will be there. And you're wondering, sina kulanga mboga, I have been eating all these fibers that you've been telling. That constipation is not going anywhere. Okay? Also remember, 1 meal a day, 1 meal will help in easing the constipation. Why? Because you allow your body to digest adequately, absorb, and then the gut to rest. When the gut rests, it concentrates the acid, it restores the pH, and it also activates the enzymes that are used in the digestion process in the subsequent meals that you're going to take. So eating 5 meals per day, eating 4 meals, 3 meals, it's not necessary. It's 1 meal a day. If you must go to the extremes, 2 meals and no snacking in between. Okay? And then drop those laxatives you're taking, please. And then as you go to the washroom, as you poop, ensure you're squatting. Okay? Good. These are a few tips, general tips that will help you in recovering from your constipation. I hope this helps.